Man.
Hi.
Hello.
My name is Jennifer Jenkins, and I'm a student with East Georgia State College. Could you state your name for me, please?
Michael Bell.
Can you tell me why you're here today, Mr. Bell?
Taking an exam.
And do you know today's date?
Yes, ma'am. It's Sunday, the 9th,
Okay, do you know what state you're in?
Georgia.
And do you know who the president is?
President Donald Trump.
All right, we're gonna get started here. I have a summary of questions, and if I'm going too fast, just let me know. And if you need me to repeat anything, just let me know, okay?
Yes, ma'am.
All right. Okay, so, Mr. Bell,
Yes, ma'am.
could you give me your age, please?
44.
And do you identify as male or female?
Male.
And I have high school for your highest level of education. Can you give me your date of birth, please?
1/12/76.
And you're married?
Yes, ma'am.
African American is your ethnicity?
Yes, ma'am.
And your occupation is a floor tech?
Yes, ma'am.
All right. You're here today for a comprehensive exam, correct?
Yes, ma'am.
Do you have any present concerns at this time, health issues?
No, ma'am.
Okay. Any childhood illnesses or anything?
No, ma'am.
Any accidents or injuries?
No, ma'am.
Serious or chronic illnesses?
No, ma'am.
Hospitalizations, maybe?
No, ma'am.
Operations?
No, ma'am.
Immunizations. Are you current? I see your flu vaccination was given on 9/15. Is that correct?
Yes, ma'am.
And your last examination I see here was June 6th of 2019.
Yes, ma'am.
No known allergies. Is that correct?
Yes, ma'am. That's correct.
All right. And then at this time, I'm going to take your vital signs. Okay. Do you mind stepping to the exam table?
Yes, ma'am.
So how are you today, Mr. Bell? Mike, I'm sorry.
That's okay. Doing good.
That's good. That's good. At this time, Mike, I'm going to take your vital signs, okay?
Yes, ma'am.
And I do remember hearing you say that you had no current issues
Yes, ma'am. That's
of
correct.
hypertension.
That's correct.
All right. At this time, I'm going to proceed as if I'm getting Mr. Mike's vital signs. I will go under his tongue at this time and take his oral temperature. I will also get his O2 at this time. And I will also get his blood pressure at this time. Can you extend your arm for me? You can relax. See your finger, please. And at this time, I'm going to axillary temp under your arm, okay? this time, we're gonna finish up our questionnaire. I'm gonna get rid of my gloves and I'm gonna wash my hands. And you can have a seat back over there, Mike.
Yes, ma'am.
And we'll continue with the questionnaire. Are you taking any current medications at this time?
No, ma'am.
And you say you don't have a family history of hypertension, CHF, or diabetes at this time?
No, ma'am.
Your general overall health status. How do you think you would describe your overall health right now? Are you eating 3 balanced meals a day?
Yes.
Consuming plenty of liquids, water mainly?
Yes.
Any
Plenty of water.
caffeine? Any caffeine?
Maybe in the morning for coffee.
Okay. Do you smoke?
No.
All right. Do you have any issues with your skin, such as eczema or acne?
No, ma'am.
What about your hair? Do you have any problems? I see that you have the beard here. Any problems with your beard?
No, ma'am.
All right. You just stick your hands out for me. Let me look at your nails. Okay. Short and clean. Any problems with your vision?
No, ma'am.
What about your ears? Any pain or drainage or hard of hearing maybe? What about your nose? Any drainage, pain, or soreness?
No.
What about your mouth? Are you missing any of your teeth? Any problems with dry mouth?
No.
All right. Hard time swallowing maybe?
No.
Okay. Any problems with your breathing?
No.
Any problems with your trachea that you know of? With your thyroid gland?
Not that I know of.
And you said you don't have any cardiovascular issues at this time, heart murmurs or irregular heartbeat.
No.
And what about in your lower extremities? Do you feel like they're cool, or sometimes you don't hardly feel a decrease in like sensory, maybe like pinching or feeling warm or heat? When was your last bowel movement?
Today?
All right. Do you have any other problems with your abdomen, swelling?
No.
That's the insurance thing. All right. With your urinary, do you have a problem starting to stream?
No.
With urgency or frequency?
No.
All right. For your sexual health, are you heterosexual or homosexual or active, or other partners? Heterosexual?
Yes.
Do you have any pain or notice any popping sounds with your joints or bone movement?
No, ma'am.
All right. Do you have any problems with your spleen or lymph nodes, maybe swelling or inflamed, or any issues with your blood, thinning or clotting problems maybe?
No, ma'am.
All right. And how do you feel at this time? Do you have any suicidal thoughts or homicidal thoughts?
None of that.
None of that. Do you exercise?
No.
On a good night, or any night for that matter, do you rest at least 6 to 8 hours?
Yes.
Nutrition, do you get 3 balanced meals?
Yes.
All right, with your interpersonal relationships, I see that you're married. Do you have a good support system?
Of course.
All right, and with your coping and stress management, how do you manage?
Church.
Church, all right.
Yes, ma'am. I'm going to church.
All right, nothing wrong with it. Your personal habits. What do you like to do?
Read.
Mm-hmm.
Watching TV.
All right. And in your home, for your environmental hazards, do you have smoke detectors in the home?
Yes, ma'am.
Do you experience intimate partner violence?
Ew.
Occupational. I see you're a floor technician.
Yes, ma'am.
Any problem with body mechanics on your back or anything?
Nah, ma'am.
All right. And so, what's your perception of your own health? Are you interested in any resources I can provide to you to help with exercise?
Yeah.
Okay. All right. Do you feel agitated or frustrated at times?
No.
All right. right, so at this time, that completes my questionnaire part of my assessment, and I'm not going to look at you physically from head to toe. This assessment does not hurt. It may be uncomfortable, but it's not painful at all. Are you ready?
Yes, ma'am.
All right, let me get prepared. All right, Miss Mike, at this time, I'm going to complete the second half of the head to toe assessment. And if you have any questions or concerns throughout the process, just let me know, okay?
Yes, ma'am.
All right, I'm going to be a little impersonal right here, but I need to examine your head, okay? Does that hurt?
No, ma'am.
Any bumps, braces?
No, ma'am.
Abrasions, I'm sorry. So you have a cut here. How did that happen? You mind me asking?
Hit my head.
Hit your head, all right. I'm going to hold your head up and inspect your beard here. Could you look straight ahead at me? Straight ahead at me? Mm-hmm. Could you look up? Mm-hmm. All right. At this time, I'm not gonna check your ears. Any pain or drainage that you know of in your ear?
No, ma'am.
No? All right. I'm gonna pull a little bit back. Any pain? Does that hurt?
No, ma'am.
Look at the other side. Does that hurt?
No, ma'am.
All right. Get your look up for me. Look up your nose on here. All right. Any problems with your nose or anything?
No, ma'am.
Okay, so at this time, this may look like a pitchfork. What I'm going to actually do now is I'm going to hit it here. There's two ways we can test for your hearing. Either I can use this, I see the look in your eyes, or we can do the whisper test. Which you prefer, the whisper test or this?
We can go with that.
We can go with this? All right. So I'm going to hit this here, and you let me know if you hear the sound. Now at this time, I'm gonna come in from the side. I'm gonna dim the lights. And what I'm looking for your eyes to constrict equally and at the same time, okay? I'm gonna dim the lights for this part, okay?
Okay.
All right, you can just focus right there on that wall. And I'm gonna come in from the side, okay? Pupils are equal. All right, so at this time, I'm gonna do the 6 fields of cardinal gaze. You're gonna watch the pen light, hold your head still, but wherever the pen light goes, I need you to follow with your eyes, okay? Let me know when you're ready.
All right.
All right. Good job, Mr. Bell. So at this time, I'm gonna come down, I'm gonna inspect your mouth, okay? Before that, I'm gonna palpate your lymph nodes, and you let me know if you feel any painness or tenderness or soreness at this time. Does that hurt?
No, ma'am.
It doesn't hurt? All right, so at this time, I'm gonna also palpate your carotid. I'm gonna put my hands on one side, then I'm gonna do the other one, okay? Strong 2+. Strong 2+. Then I'm gonna also turn you this way, and I'm gonna check for jugular vein distension, okay?
Yes, ma'am.
Take a deep breath in and then out for me. There you go. of hair braided hair. Alright, you can turn your head back around for me. And then at this time, I'll be looking and inspecting in your mouth, okay? And your nasal as well. You look up for me. No problems with your nose, correct? Alrighty. Can you open your mouth for me, please? And then I'm gonna put this in so I can look around in there, okay? I'm gonna actually just stick your tongue out. Say, ah. Alright, and at this time, I'm trying to check it for your. So, let me see. Lift your tongue up for me. There you go. Stick your tongue back out for me. And I'm gonna see if I can initiate the gag reflex. There we go. Thank you. So at this time, I'm now going to examine your chest, your front, and your back. I'm going to listen to your heart sounds and your lung sounds as well. And as I'm doing this part of the assessment, I'm also going to be looking at the top part of your skin and checking your capillary refills, okay? And then we're going to test your muscle dexterity at this time as well, okay? And could you lift your arm for me, please? All right, you can put it down at this time. And next I'm going to ask you to take a deep breath in and a deep breath out, okay? Deep breath in, please. And out. Good job. Deep breath in. Deep breath out. I'm going to actually turn to the side for me. Deep breath in. Deep breath out. And again for me, please. In and out. There you go. And then again. And again. And again. And again. Thank you. So what I'm going to do at this time as well is I'm going to listen to your abdomen, okay? And at this time, can you grab my 2 fingers and squeeze? All right, and then you can let go. And then hold your hands up for me. And then I need you to try to go against resistance, okay? There we go. And let's really push this everything. And I hear you clicking noise. All right, and I'm gonna inspect your skin. See how it fits. Capillary refill is good. so at this time, Mike, do you mind laying back for me?
No, ma'am.
Thank you. And although I just listened to your abdomen, I just want to do some light palpating, okay? All right, and you let me know if this hurts, okay?
Okay.
What about that? It doesn't hurt?
No, ma'am.
Okay. Alrighty. Doesn't hurt?
No, ma'am.
Alright. At this time, I'm going to be inspecting your legs, and also I'm going to be feeling for your pulses, okay?
Okay.
The hair is full and intact. Alright. Strong popliteal pulses. Then I'm going to go here for the posterior pulses. And then for the dorsal on the top, and they're all strong and 2+. All right, Mike, I'm gonna help you back to the side of the bed. And then could you scoot to the edge for me? Put your feet flat on the floor. There we go. And I'm gonna check your, well, before I check your reflexes, I'm gonna get down here. And I want you to flex your feet back and forth for me.
Mm-hmm.
Go now. All right. Good job. Okay, could you hold your foot up for me? All right. And then I'm gonna just text for your reflexes. Slide back for me. Alrighty, Mr. Michael. Alright, Mr. Mike, I have one more task for you to complete here. Could you stand up for me? Alright, at this time, I'm going to ask you to close your eyes and extend your arms forward for me. And what I'm looking for is to see if you have good balance. Alright, you put your hands down, open your eyes, and sit down slowly. Alrighty, Mr. Michael. Do you have any questions or concerns for me at this time?
No, ma'am.
Well, I'm gonna get rid of my gloves, wash my hands, do my hand hygiene. Thank you for coming in,
Thank you.
and the doctor will be in to see you shortly.
Okay.
This concludes my comprehensive health exam.